Why do we do first aid? We have three most important reasons why we do first aid, and I will explain each one of them as I state them. Aims of first aid, or you can call them 3 P's. The first one is to preserve life. Your main goal should be to keep the person alive, not only the casualty's life, but your own as well. Far too often, only one person's life is in danger when the emergency services are called, but at the time they arrive, they are more. If you put your life in danger, you can end up fighting your own life instead of the casualty. The second aim is to prevent the situation from worsening. Keep the injured person safe and from becoming injured anymore. It is always recommended that you do not move them until help arrives. The skilled first aider must take action to prevent the whole situation from worsening, like controlling traffic, as well as acting to prevent the casualty's condition from deteriorating. The third one is to promote recovery. Try to help fix their injuries as best as you can. The actions of a first aider should, after preventing things from worsening, help the casualty to recover from their illness or injuries. We have a couple of orderly steps to follow while dealing with casualties. First one is primary survey. The first priority with the patient is to make sure the airway is open and then to check whether they are breathing normally. If the casualty is breathing normally, that means their heart must be beating, so blood is being circulated around the body. The second priority of treatment is secondary survey. Once you're happy that the casualty is breathing normally, oxygen is being circulated around the body, the next priority is to deal with any major bleeding, because you need to maintain enough blood to circulate the oxygen around the body. After these steps, the next priority is to deal with the broken bones. Let's hold there for now about primary survey and secondary survey. We're going to deal with these two steps later. But for now, let's learn about incident management. We have 5 action plan at a site of emergency. The first one is assess the situation. The second one is make area safe. The third one is emergency aid. The fourth one is get help. And the fifth one is aftermath. Now I will explain each step with more words. And we'll start with number 1, which is assess the situation. First, you need to ask yourself some questions. And this is what to consider when assessing the situation. What happened? When and how it happened? Is there any danger to the aider, bystander, or the casualty? What is the gravity of the incident? What is the number of the casualties? What are likely injuries? What are the number of vehicles involved? And many more questions depending with the incident. Now, after questioning yourself, identify any danger first to yourself, bystanders, and then the casualty. Use your eyes, ears, and nose to look for signs and clues. For example, the hiss of gas or the smell of petrol. Decide what happened, how many casualties they are, and where they are. Remember, be aware of casualties who may be hidden behind hedges or wreckage, or who have wandered away from the immediate vicinity of the incident. Decide what resources you have available, and again, be calm and take charge unless there is anyone more qualified than you, in which you will still offer assistance. The second point or action plan in incident management is to make area safe. Make the area safe and put your own safety first. Eliminate any obvious danger without putting yourself at risk, and if you cannot handle the risk, get specialized help like police, fire department, KPLC, ambulance, aqua rescuers, or any other that you think they will be of any assistance or your assistance. Crowd control is important to avoid more casualties and fatalities. For instance, in a high voltage electrocution incident, everyone should stay at least 20 meters or 18 yards away from the casualty until the power supply is cut off. No one is allowed to smoke at an accident scene because it could start a fire. The third step is emergency aid. Emergency aid is the immediate life-saving treatment given to a casualty. Once the scene is safe to move in, treat casualties according to priorities, which are A, B, C. We will see them shortly. And priorities of life, which are very crucial for every casualties, are, we start, airway, which includes the mouth, nose, and windpipe. Airway should be open. Check for any obstruction in the mouth, but tongue is the commonest. All unconscious casualties are at risk of obstructed airway by the tongue or any fluids or vomit. So as a first aider, you should make sure the airway remains patterned as your first priority. Don't forget, your first priority is to make sure airway is open. The second priority of life is breathing. This is essential for life. We take in air, which contains 21% oxygen to our lungs, where some of the oxygen, around 5%, is absorbed into blood. The air we breathe out contains oxygen, or enough oxygen, which is around 16%, to save someone's life. It will be enough, yes. It is the oxygen that is used when doing artificial ventilation or rescue breath. The nature of the breathing can also help in this diagnosis. The third priority of life is circulation. Once oxygen is absorbed into blood in the lungs, it is distributed to the rest of the body and the heart. The heart is a pump that pumps blood to the lungs for oxygenation, then to the rest of the body through arteries, which then branch into smaller vessels called capillaries, so as to reach all body tissues. Blood then flows back to the heart through veins and start the whole cycle again. Without circulation, oxygen cannot reach the tissues it's intended. In fact, if the heart stops, breathing also stops. Now we go back to our incident management step 4. Get help. How to make a call when requesting for help. If you need first, you need to be calm, clear and concise so you can remember to give as much details as possible. Depending with the situation, you may have already called for the assistance of emergency services or ensured maybe that somebody else has done so for you or on your behalf. When calling the emergency services, it's important to include the following information. caller's identity and phone number. Say who you are. State your location and any landmarks of where you are. Inform the nature of the casualties, sex, and approximate ages. Tell any action taken. Say any materials needed. Any environmental hazard and other prevailing condition like heavy traffic. And at the end, confirm clarity of your information and ask how long the ambulance will take to reach you. And be the last one to hang up the call. In summary, under point 4 of getting help, an emergency call can be made easier for you to remember, or it has made easier for you to remember what to say without missing a point. We use code 4WCT, which is easier to remember. The first W is who you are, and also give your number. The second W is what has happened, and give clear details. The third one is what you need, the main reason you're calling, man. The fourth one is where you are, and give exact location or any landmark. The C is the clarity, and also you can add casualties, how many they are or their approximate age. T stands for time. Ask how long they will take to arrive at the scene. So remember to say who you are, what has happened, what you need, where you are, clarify the message or information, and then time, how long you're going to take or how long they are going to take to get to where you are. As a first aider should hand over the casualty to appropriate person as per condition and ensure that all casualties have been disposed of to hospital or the nearest health facility. When calling, decide which emergency services you require or are required. For example, police department, fire department, or ambulance services. Consider whether other form of help may be needed and ask the police to notify them, like utility and health service. Also get help from other people to help you. You can use bystanders around you. Make the area safe. Telephone for assistance. Find and fetch equipment. Control traffic. Give them something to do. Keep them busy. The onlookers. Control bleeding with your guidance if they don't know how. And others can be, and others to maintain maybe casualties' privacy. If using bystanders to call for help, give clear instruction, please. Ensure they report back with any or all message, and so that you can obtain confirmation that help has been called, and you need to know what they have said. So make sure that the bystander you sent to make a call has reported back to you and has given you the information that he has received from the other end. The last action plan of incident management is aftermath. After giving first aid, a number of things should be done. Clear the scene and make it safe, taking caution not to interfere with the evidence if it's a crime scene or otherwise. And write a report if required to as well. Restock first aid kit. Contain the casualties next of kin. Contact the casualties next of kin. And manage any stress that may follow the event. Your job does not end when the emergency services arrives. Your responsibilities may include taking care of casualties' personal belongings and ensuring they go with the casualty or are returned to the casualty or are put in care of reliable friends or relatives. And also make a report to the ambulance crew or to whoever will receive the casualty. This report or the report will include casualty's name and address if known, history of accident or illness, brief description of injuries, any unusual behavior, treatment given, and also remember to give your information like name and mobile phone in case medical personnel want some clarification from you who handle the casualty first. Thank you.